Hi, I'm Michelle Burnler and I work for Western Australian Association of Mental Health. As part of the NDIS Quality and Safeguarding Sector Readiness project, today we'll be talking about audit processes. Before we begin, I'd like to acknowledge the traditional custodians on the land of which this is being filmed, the Whadjuk people of the Noongar Nation. I pay my respects to elders past, present, and acknowledge that this is Aboriginal land that was never ceded. I also extend those respects to any Aboriginal or Torres Strait Islander people watching today. I would also like to acknowledge the courage and contribution of people with lived experience, whether that is lived experience of mental distress or of caring for someone with mental distress. Those with mental distress have shaped the way for us, and we really do stand on the shoulders of giants. Audits. Why do we have them? I know I prefer to know the purpose of something before I undertake it. So let's look at why we undertake audits at all. Essentially, the NDIS Quality and Safeguarding Commission exists in part to ensure that all registered NDIS providers are providing quality services to participants and ensure the safety of those participants. As many of you may know, participants whose funds are NDIA managed can only use registered providers. This limits their options, but in theory safeguards them by ensuring the people who provide those services do so in a high quality way that protects their safety. So audits exist to ensure that all registered providers are providing high quality, safe services. They're also a great opportunity to ensure your service is providing up-to-date practices and encourages you to continually improve rather than becoming stagnant. So what does a registered provider need to do to reach audit? They must comply with the NDIS practice standards and quality indicators, something we explored in a previous webinar. They must have an in-house complaint management and resolution system that supports participants to make a complaint. They must have an in-house incident management system and notify the NDIS Q&S Commission of reportable incidents in a timely fashion. They must comply with worker screening requirements and, if providing behaviour management support, meet the behaviour support requirements, also known as Module 2A. They must comply with any additional conditions put forth by the Commission and notify the Commission of any changes or events that could affect registration, such as a new CEO. So what is an audit? Essentially, an independent, approved quality auditor will assess your organisation against the components of the NDIS practice standards that are relevant to the services and supports you deliver. When do audits take place and with what frequency? The first thing you need to know is there are two types of audit. One is the verification audit. This is relevant for low-risk supports such as cleaners and gardeners. The requirements for verification audit are more straightforward than the other audit, which is certification audit. Certification audits are a requirement for those providing behaviour support, or SIL, supported independent living, amongst others. A verification audit takes place every 3 years and is measured according to the verification practice standard module. It is off-site, meaning that it is undertaken online with no physical presence required, and is, as mentioned, for activities that are considered low risk. The certification audit has a 3-yearly cycle, but with a mid-term audit at 18 months. So in practice, there is an audit every 18 months. The requirements that must be met are at the very least the core practice standard modules, but may also include other modules depending on activities undertaken. For example, Module 2A if providing behaviour support, or the Specialist Support Coordination module if providing specialist support coordination. They are conducted both on-site, visits to the office, and off-site, online and via a phone call. This image demonstrates the 3-year audit cycle for certification audit. As you can see, you undertake your initial audit, then 18 months later have a mid-term audit. 18 months after that, you have a recertification audit. Remember, this is for service providers who are undertaking higher risk activities such as SIL, supported independent living. For a verification audit, an audit undertaken for low risk activities, there is a single audit every 3 years, no midterm. So what does the registration process look like? You provide your initial information to the NDIS Quality and Safeguarding Commission. and you select your registration groups, which activities you will be registered to undertake. This could include things like this. Once you've selected your registration group, you will know whether you need to undertake a verification audit or a certification audit. And you can then undertake a self-assessment against the relevant practice standards. You will enter this data onto the Commission's website and receive your initial scope of audit document, which will confirm what type of audit you must undertake. You then need to select an approved quality auditor. To find a quality approved auditor, go to the NDIS Commission's website and select Find an Auditor. You then undergo audit. Proportional requirements means a provider with only a few workers and a small number of participants needs to present a different level of evidence to meet requirements compared to a national provider with a large workforce and many participants. When we talk about size and scope, size refers to the number of staff you have and the number of participants you support. Scale refers to the number of service delivery locations you have and where these are located. For example, if they are metro, regional or remote. Scope refers to the types of services and supports you provide in line with your NDIS registration groups and their associated level of risk and complexity. And finally, a suitability assessment is made by the NDIS Quality and Safeguarding Commission. So what should you do if you're being audited? The first step is to make a plan. You want to access the NDIS Quality and Safeguarding portal and conduct a self-assessment. You want to then develop a plan and book an auditor. Review all documentation, including service agreements. Document your future actions in a continuous improvement register and provide information to the auditor as required. You will be audited on documentation, systems and practice. This is a sample documentation request. This is a sample auditor response, and as you can see, there are compliance ratings. Let's explore what these ratings mean. A compliance rating of 3 means the NDIS provider can clearly demonstrate conformity with best practice against the criteria. Best practice is demonstrated through innovative, responsive service delivery, underpinned by the principles of continuous improvement of the systems, processes, and associated with the outcomes. A compliance rating of 2 means that the NDIS provider can clearly demonstrate that the outcomes and indicators are met as proportionate to the size and scale of the provider. Evidence may include practice evidence, training, records, and visual evidence. This would mean there was negligible risk and certification can be recommended. A compliance rating of 1 will require a corrective action plan which reduces the likelihood of any risks identified that may impact participant safety before certification or verification can be recommended. One of the two situations usually exists in relation to a minor non-conformity or a compliance rating of 1. There is evidence of appropriate process, systems or structure implementation, but without the required supporting documentation. Or a documented process, system or structure is evident, but the provider is unable to demonstrate implementation, review or evaluation where this is required. Finally, a compliance rating of 0. This is where an NDIS provider is unable to demonstrate appropriate process, systems or structures to meet the required outcome and indicator, and/or the gaps in meeting the outcome present a high risk. A compliance rating of 0 stands for a major non-conformity. It is important to note that 3 minor non-conformities within the same module constitute a major non-conformity. A rating of 0 will preclude a recommendation for verification. Here are some sample compliance ratings. As you can see, for Division 2, Governance and Operational Management, There are 3 minor non-conformities, in other words, 3 that are rated 1, and therefore the whole module is given a 0 for major non-conformity. When we talk about non-conformities, a minor is when you are lacking evidence of policy or procedure or lacking evidence of implementation. A minor non-conformity is important but not always urgent. Corrective action plans are required for the audit to be completed via recommendation to the NDIS. A major non-conformity is not demonstrating meeting the NDIS requirements. It has an urgent action requirement and prevents re-registration or registration at all if this is your first audit. Corrective action plan must be implemented within 3 months. This is an example of a non-conformity. Remember with compliance ratings that higher is better. Think of it as a star rating system. For more information regarding audit processes, please visit the Care Hub's NDIS Sector Legacy Toolbox. Thank you for joining us on this webinar.